All right, I'm here with Dr. Bob Alexander. You're one of the top innovators in stem cell innovation. You're also a collaborator with Tulip. Now, I want to know how you became involved with Tulip and Tulip NanoFat.
Well, in plastic reconstructive surgery, lipoaspiration got popularized in the early 80s. It got sophisticated in the 90s, and they were the innovators from the system that is called a closed syringe system, so they can aspirate the fat without an evacuation pump, like you see on Facebook and those kind of stories. So once that became a more gentle, more accurate way of reducing volumes, then we started to look at grafting. Grafting became a function of the size of the cannulas and where people are putting it to augment cheeks or chins or breasts or buttocks. And those things are determined by the particle size. Therefore, as you asked me earlier about nanofat, nanofat is a way of reducing those particles to smaller and smaller fragments, but retaining all the cellular capabilities of the full fat.
Now, you're already kind of touching on my next question. So there are other procedures on the market besides Tulip NanoFat, TNF.
Yes.
And you were just touching on some of those procedures. Can you just talk a little bit more about how TNF differs from some of the other procedures?
Sure. Let's talk about the innovations of nanofat first, because they're the system that came through with very small cannulas, then passing them through small devices that would break up some of the fat cells, but leaving the important stem and stromal cell components alone. And then after the nanofat has been created, it can be injected through very small needles. So in comparison with other nanofat or micronized fat products, for example, lipogems. A lipogem is a product that you do the same harvesting, you pass it through some anaerobic transfers, just a little passage. You then shake it to break it up, and then you take it out and rinse it, and you can use that product. The advantages in Tulip is you don't waste the cells. In that process of washing, the cells many times are washed away and out of availability for the patient. And our goal here is to get as many cellular components as we can. And so we tested Tulip NanoFat because it was an efficient and inexpensive way, significantly less expensive than lipogems, to break up the small particle fat in preparation for its placement. And that it outperformed both in volumes of cells and numbers of cells and volume that was available with NanoFat. The processing was sending it through progressively smaller tubes to break up the fat, and then the final is to inject it through a filter. The filter is offset, very small openings, and in that opening breaks the rest of the fat cells up and loads a syringe, which is then capable of injecting through very, very tiny needles, 30 gauge, like you get Botox or you get fillers. 25/7 and 30 gauge were the criteria.
And so this is not just cosmetic purposes that this is being used for. It's also, there are other applications, orthopedics.
Yeah, orthopedic medical applications are getting extremely popular because the adipose contains the most reparative cells of the tissues of the body. Every tissue in the body essentially has them. There's only a couple places. So any place where these cells are present, they've got regenerative capabilities, whether that be a muscle or a joint or a ligament or a tendon, brain, it can be different tissues. And those cell types are readily available through a very minimally invasive opening. We don't use a scalpel, we don't use sutures, you just make a nick in the skin and you access the fat through the process of the Tulip system. And then after that product is done, we pass it through this filter to make the particle size smaller and smaller.
And for a sports medicine patient, for example, how would this improve their life? How would this be different than any other kind of treatments they would receive?
Well, and you'd mentioned the word biocellular, which includes that we're mixing these cells with platelet-rich plasma, which is a source of growth factors and signal proteins to have the healing mechanism start. So one of the problems in orthopedic medicine, and they're injecting into small joints, well, small joints don't have enough space for them to place a large bore needle into a joint space. So they can go through those little tiny needles safely, less pain, and it can also be very remarkable in as far as fixing, helping osteoarthritis or the ligaments and cellular components that are breaking down, like the tendons of a muscle, where the muscle's going to form a tendon and an insertion. those will often degenerate over time, and this is a very adequate means and very effective means, safe and effective to get those to repair.
So we were talking a little bit before about how you think really the future is now with TNF.
I think now that it's come to the position that the two things we need to work on in understanding these is it safe and is it effective? And so the safety factor has been well passed. I mean, we've had the NanoFat prospects probably for the last 5 or 6 years, and that it's gotten improved. New iterations has made it more effective, so there's not as much waste, not as much loss. So we have to take less amount of fat, which is always an advantage. Easy to get to. We take it from unwanted subdermal deposits, and so with the advent of the cannula system and the NanoFat screens, we've solved the problem of doing it, and we track the patients with ultrasonography or MRIs and different studies in orthopedic medicine in order to go ahead and get the best product that we can for them having the maximum impact.
Well, you seem to have a lot of experience in the field, and your insight
I'm old.
your insight is greatly appreciated. Thank you so much for joining us today.
Thank you very much.